Cancer Holistic Guidance, Part 56. Dr. Dilip Gadgil, Pune. If we take an example of a particular disease, there may be more than one cause behind it. And if we take all of them in account only, then the proper diagnosis is possible. We must have an in-depth approach towards all speculated causes in order to come up with the treatment plan. There is a common example of infectious diseases. In that, there is a primary cause to it, that is the virus, but that is not the only cause. In addition to that, our decreased immunity also plays an important role. But no one is seemed to be bothered about it. So now we are facing many of such epidemics. So what I mean to say is, we have to think of such deeper reasons while facing these diseases. Because repeated use of antibiotics and vaccinations is not the permanent solution to this problem. Knowing all the possible causes behind certain problem and then finding a solution, should be the ideal way to deal with it. When we take all the causes in the account and reach a certain diagnosis, then we can go ahead with the treatment plan. In that case, we can decide what a person should avoid, what should be his diet, and what is the principle of the treatment. Like if we should focus on digestion or any other particular function. Based on that, one can advise on taking different types of medications, and we can decide on the proportion and timings of the same. This all comes under the same concept of yukti pramana. People still feel that medicine is the only aspect of the treatment. But, in reality, medicine is just one part of the treatment. The base of any treatment is the principle of it. According to the principle, the medicine is decided and given to a patient. So, all the treatment plans should follow the same ideology. Since a very long time now, for cancer treatment, destruction of the cells is the primary principle. And for this, surgery, chemotherapy and radiation are the treatments which are in use for many years. But there is a need to take a review of these therapies, to see if the principle we have been following is working well or not. And if it is seen that there is more harm than good, then we must think of an alternative. But there hasn't been anything like this. Even though the success rate for such treatments is fairly low, still, the same practices have been going on for ages. And there has been no such thought to bring any other alternative for it. That is the most concerning thing in today's times. That